Welcome back to my channel Mis.Medicine. In this video, we will discuss about cell wall synthesis inhibitors, antibiotic drugs. If you are new here, subscribe to the channel, follow us on Instagram and Facebook. So, drugs. Mnemonic is firmly bind to bacterial cell wall. It include cell wall synthesis inhibitors include F phosphomycin, B for Betalactams, Bacterial, B means bacitracin, cell means cyclosporin, and wall means V, vancomycin. You can remember phosphomycin used in UTI and bacitracin locally used only, and cyclosporins used in tuberculosis. So in this video we will discuss about beta-lactam drugs, beta-lactam antibiotics. Why it is called beta-lactam? Because it contain beta ring, 4 carbon chain, and some other ring attached to it. This ring, second one, is different in different beta lactam drugs and absent in monobactam. So beta lactam drugs include penicillin. Second group of drug, cephalosporins. Third group of drug, carbapenems. And fourth group of drug is monobactams. So we will discuss penicillin. First one is penicillin. It includes penicillin G and benzyl penicillin. So now what are the limitations of penicillin? Penicillins are not effective orally because they are acid labile. If you will take penicillin orally, stomach acid will destroy it. First one is penicillins are not effective orally because they are acid labile. Second, they are short acting because of their due to tubular secretion, rapid tubular secretion. What is the third limitation? Third limitation is penicillins are narrow spectrum. Fourth limitation is their resistance. So many people are resistant to penicillin. And the fifth one is allergy. So we will write here acid resistant or oral penicillin drugs. You can remember it by the mnemonic vodka. Vodka means V, penicillin V. O means oxacillin. D means dicloxacillin. C means cloxacillin. And A means ampicillin and amoxicillin. Second group is how you can increase duration of penicillin G. Increase duration of penicillin G. You can add probenecid. Probenecid compete with penicillin at tubular pumps. Because of that, it increased duration of action of penicillin. Both penicillin and probenecid act in tubular secretion. When we will give probenecid and penicillin together, probenecid excreted first, then penicillin. If probenecid excreted, then penicillin work more, so it increased the duration of penicillin. And we can give IM, intramuscular drugs, benzyl penicillin G, and procaine penicillin G. IM drugs known as depot preparations, because it will deposit in our muscles and act little by little, and also secreted little by little. These are penicillin G. These are longest acting penicillin. Remember that. As I already told about spectrum of penicillin, they are narrow spectrum. They act on gram positive and gram negative bacteria, gram positive cocci, and gram positive bacillus. It include cocci includes streptococcus and staphylococcus, and bacillus it include bacillus, clostridium, diphtheria, listeria, etc. And in gram negative, it also include cocci and bacilli. Cocci, it include Neisseria, meningococci and gonococci. But penicillin G are not effective on bacillus. Gram negative bacillus. We already discussed about wide spectrum penicillin G. Now, extended wide spectrum penicillins include which drugs? Extended wide spectrum penicillin. Its mnemonic is a city map. A means ampicillin and amoxicillin. C means carbanicillin. T means ticarcillin. M means meslocillin. A means azlocillin. And P means piperacillin. Piperacillin. Except ampicillin and amoxicillin, these all are anti-pseudomonal drugs. And one thing also, vancomycin is not effective against pseudomonas. Vancomycin not effective against pseudomonas. Now the fourth one is beta-lactam inhibitors. When patient is resistant to penicillin drugs, so we have to do some special things. We have to add some another drug so that penicillin can work. It include flavulonic acid, plus we can give amoxicillin. Second drug, sulbactam plus ampicillin. Third one, tazobactam plus piperacillin. So now penicillin is resistant penicillins. We will write here penicillin resistant penicillins. What are the drugs? Penicillin resistance penicillins. Here is some mnemonic. Condom. It include C, cloxacillin, O, oxacillin, and nafcillin. O we already discussed. D, dicloxacillin. And M is methicillin. And here methicillin is most resistant penicillin. And what we will do when methicillin is resistant? Here is one drug which is methicillin resistant Staph aureus, MRSA. It resistance due to alteration in penicillin binding protein. And beta-lactams are ineffective in methicillin resistant except 5th generation cephalosporins. This is important note. Beta-lactams are ineffective except fifth generation cephalosporins. Except, I will write in another color, fifth generation cephalosporins. We will discuss about cephalosporins in another video. So, and what is the drug of choice in MRSA if methicillin resistance? So, what we can give? What is the drug of choice? So, drug of choice for methicillin resistance is vancomycin. Important. And now the main thing is where we can give penicillin G and what are the indications of penicillin G. So, indications of penicillin we will write here. First line drugs of penicillin G we can use in which bacteria or in which disease you can say. So, first line drugs of penicillin G, its mnemonic is last man. First one is L. L is listeria. Penicillins are first line drugs in listeria. Actinomycosis. S means syphilis. T means tetanus. M means meningococcus. And AN means anthrax. These are the first line. So these are the indications in which we can use penicillin as first line drugs. So what is the drug of choice for listeria if penicillin are the first line drugs? For listeria, drug of choice is ampicillin. Second one is syphilis. And syphilis are many types. It can be primary, secondary, latent, and tertiary syphilis. And how we can give penicillin in these cases? In first, second, and latent are also early and late. Two phase, two type of latent syphilis, early and late. In primary, secondary, and early latent phase, we give single injection of benzathine penicillin G IM route dose of 2.4 mu. IM. And in tertiary, and here also one more type which is neurosyphilis, I forgot that. In tertiary and latent phase, we give 3 injections. 3 injections of benzathine penicillin IM. 1 injection per week with the same dose. And in neurosyphilis, we give penicillin G, aqueous or crystalline form, is the drug of choice for neurosyphilis, and procaine penicillin G can also be used for the treatment. Penicillin G is the drug of choice for neurosyphilis. Next condition is tetanus. What is the drug of choice in tetanus? Drug of choice and first line drug for tetanus is penicillin G, which is metronidazole over metronidazole. We can give metronidazole also in tetanus, but first line and drug of choice is penicillin G. Next condition is meningococci. How we can treat it and what are the prophylaxis? Treatment and prophylaxis. Treatment can be empirical and definitive. Empirical treatment means it is based on experiment. It includes ceftriaxone. And definitive treatment which is best for the patient, which is penicillin G. We can write. And for prophylaxis, two drugs. First is ciprofloxacin and the second one is ceftriaxone. Some important things about ciprofloxacin and ceftriaxone. Ciprofloxacin are less effective and they are contraindicated in pregnancy and children, and it can be given orally, and it is drug of choice for prophylaxis of meningococcal meningitis. And the ceftriaxone, it is more effective than ciprofloxacin. It is drug of choice in pregnancy and lactation, and it is injectable only. And in the prophylaxis, we can't give everyone in injection form or in IM drugs, so we have to give ciprofloxacin as prophylaxis. Next condition is anthrax. What is the drug of choice and first line treatment of anthrax, which is penicillin G over ciprofloxacin. And the next condition is gonococci, Neisseria. Drug of choice for gonococcal urethritis is ceftriaxone, UTI. Gonococcal. For gonococcal urethritis, drug of choice is ceftriaxone. And drug of choice for non-gonococcal urethritis is azithromycin. And drug of choice for mixed gonococcal and non-gonococcal is azithromycin. So, cell wall synthesis inhibitors. The mnemonic is firmly bind to bacterial cell wall. Firmly means phosphomycin, which help in UTI. Bind to betalactams, bacterial bacitracin we use locally, and cell cycloserine we used in tuberculosis, and wall vancomycin. Next, we discussed about betalactams. It includes penicillin, cephalosporin, carbapenems, and monvectams. And penicillins, these are acid-labile, short-acting, narrow-spectrum, allergy or resistant. And acid-resistant oral penicillin, the mnemonic is vodka. It includes penicillin V, oxacillin, dicloxacillin, cloxacillin, ampicillin, and amoxicillin. And next, we discuss which increased duration of penicillin G, which is probenecid, and depot preparation. We discussed about spectrum of the penicillin G, extended wide spectrum penicillin G, which is mnemonic is ACT-MAC, and vancomycin is ineffective in Pseudomonas. Next, we discussed beta-lactam inhibitors and penicillin-resistant penicillin inhibitors. And we discussed about MRSA, which is methicillin resistant staph aureus. Drug of choice is vancomycin. Next, we discussed about indications: Listeria, actinomycosis, syphilis, tetanus, meningococcus, and anthrax. I hope you liked the video. Thank you.